In the United States, our healthcare is among the most expensive in the world, but we don't get the best care. Our system is broken, but without understanding it, we can't fix it. In order to help decode it for you, I'm going to use the analogy of buying groceries from a supermarket. Now think about your weekly trip to the supermarket today. You prepared in advance, you know what you need, you make a list. You even have coupons to make sure you're getting the best deal. Now high on your list are canned beans. You check out the variety and the brands and choose the best deal from the brands your family likes. There's a lot of competition when it comes to growing and packing and delivering those beans. So you know what? You get a pretty good deal. You head to the checkout with all of your items and you spend $50, right on budget. Now imagine you're back in the store. And just like you have a health insurance plan for your health care, this time you've got a food plan for your food paid for by your employer or the government, who simply takes $25 out of your paycheck each week, and you can buy all the food you want with just a $10 copay. Let me say this again. No matter how much the food actually costs and how much you get, you only have to pay the $10. You go back for your beans. But now, there are no prices on the products and there are no familiar brand labels. Fortunately, a store employee in a white coat tells you what to get, so you do. They know better, right? And because you're paying $10 regardless of how much the food actually costs, you don't even think about the price. So maybe you even throw in a few extra items. Why not? It's free. You just swipe your food plan card and you pay your $10. At the end of the week, you get a notice, not a bill, from the food plan company that says your groceries, which you used to spend just $50 on, now costs $100. But the food plan company pays for it. Now, you think it's strange your groceries cost much more than they used to, but it doesn't bother you because you only paid $10. What just happened? A couple of things. You and everyone else used to look for the best deal on your can of beans. But now you never even shop around. And you and everyone else is buying a little more food because it's all free. Meanwhile, the supermarket has been expanding and upgrading the store with exotic and expensive foods that you might have always wanted, but you never could have afforded. In healthcare, that's things like the latest cutting-edge equipment and medications that you might think twice about receiving if you were the one paying the full price. So you splurge on these exotic foods, but not all the time. Even if you don't buy them, your store still has to pay for all the new inventory. So they raise the price of all the food in the store. All the other markets in your area do the same thing. But someone's got to pay for this, and ultimately, that's going to be you. Now you check your pay stub and discover your employer is taking out $100, no longer $25 of your paycheck each week to pay for your food plan. You're not happy about that at all. But without your food plan insurance, you could never afford your now enormous grocery bill. In healthcare, people without insurance also drive up costs. Same in our imaginary world of food plans. So now imagine there are a lot of people who have not gone to the market in a long time because they don't have a food plan. So when they finally do go, they're really hungry and they fill their carts till they're overflowing. At the checkout, if they have the money, they pay up. But it's usually not enough because food has gotten so expensive. Because everyone has to eat, the store gives them their groceries anyway. And since the shoppers can't pay, the supermarkets increase the price of everyone else's food to cover their losses. So that cart of groceries that was once $50 and went up to $100 and then $1,000, well, now it's $5,000. And the food plant increases its prices to cover the shortfall. And your $10 copay now goes up to $50. With all these rising costs, perhaps the biggest challenge in healthcare is to give everyone affordable insurance, even people who have expensive pre-existing medical conditions. Here's what happens when that gets factored into the food plan. The mayor in town wants to make sure everyone has a food plan, so she sets up a system to make sure everyone can buy one. This food plan covers another kind of shopper, the kind that has a pre-existing condition which requires them to buy twice as much food as you do, at twice the cost. yet they still pay the same $50 copay you do. The food plan company wants to charge these people more or not give them a plan at all. But the mayor says the food plan company not only can't deny them a plan, they must also charge all the shoppers the same price. This causes the food plan company to raise the price on everyone's plan in order to stay in business. As costs skyrocket, some healthy shoppers stop going to the grocery store, and employers eventually cut back on their contributions or they leave town, leaving you without a plan or food. Over time, the food plan company has a hard time making ends meet, and so does the supermarket. So how do we solve it? One of the possible ways out is to build a new plan that empowers shoppers to care once again about their purchase decisions and allows the supermarket to treat its customers as frugal, practical, and intelligent decision makers who will buy only what they really need.